Hi, I'm Imani.
I'm Itzel.
I'm Gabriela. Heidi Garcia.
I'm Lupe.
Eileen Morales. I'm Cynthia Chavez.
And this will be on the Theory Suggestions Increasing Latinas' Reproductive Health. The health issue we will be focusing on today is cervical cancer among Hispanic women within the ages 25 to 44 years of age. Our primary focus will be on Latina women within the Los Angeles area. Cervical cancer occurs in the lining of the cervix, the lower part of the uterus, also referred to as the uterine cervix. It can be caused by some types of HPV, which is a commonly sexually transmitted disease. The behavior that will be implemented is encouraging Latina women to get screenings in order to maintain a healthy lifestyle. Here is a video on cervical cancer in Hispanic women.
Did you know that cervical cancer is a highly preventable disease? That's because of Pap tests and the HPV vaccine, which are effective preventative methods against cervical cancer. Despite this fact, the cervical cancer rate is 60% higher and mortality is twice as high among Latinos compared to non-Hispanic whites. In the Florida Cancer Registry data, this disparity is even more obvious as recent immigrants from South American countries have cervical cancer rates as high as 16 per 100,000, which is almost twice the U.S. national rate. One concerning fact that might be a contributing factor to this disparity is that there is a significantly low number of Hispanic or Latina women that had recent Pap tests compared to non-Hispanic white and Black women. This fact led me to think about what barriers that Hispanic or Latina women face in receiving Pap tests. These major barriers are limited access to healthcare, lack of knowledge of cervical cancer, and limited number of providers with Hispanic speakers. Limited access to healthcare could be due to Hispanic women having public insurance or are uninsured. Lack of knowledge about cervical cancer is present due to misinformation from their home country and stigma about having a male examiner. Language barriers present in healthcare settings can also discourage Hispanic women from getting Pap tests because of lack of communication, which leads to distrust. In order to reduce cervical cancer rates among Hispanic women, I had to consider what solutions could be done to reduce these barriers. To ensure the effectiveness of my health communication plan, I have contacted a local leader from the National Cervical Cancer Coalition Society, which is the program of the American Sexual Health Association. One valuable lesson they emphasized was, prevention starts with education. Remember, prevention is the most effective if you meet the people in their environment. When planning for this communication health plan, I decided to take this advice into consideration. The focus of my plan is to reduce the three major barriers primarily through education about preventative methods. The USF campus is an ideal location to implement this plan because of the many Latinx student organizations and the nearby health services available. These presentations can be held at various locations of the USF campus, such as the Marshall Student Center. They will focus on how to overcome the three major barriers by spreading awareness about the National Breast and Cervical Cancer Early Detection Program, which provides uninsured and underinsured women no-cost screening, diagnostic, and outreach services, which are provided in the Hillsborough County. Discussing the damaging effects of cervical cancer, explaining the benefits of preventative treatments like Pap tests, reducing stigma of cervical cancer examinations, and informing our audience about available resources near the area, such as the USF Moffitt Center, which does provide cervical cancer preventative care and Spanish-speaking services. Implementation of an advisory board from the USF Hispanic community would be beneficial to the program because it would help ensure that the educational presentations are appropriate and not culturally insensitive. Social media such as Facebook and Twitter will not only be used to advertise future presentations, but it would also be a helpful way to contact and collaborate with the various Latinx student organizations at USF to reach the surrounding Hispanic population at a community level. Hopefully, this health communication plan will be a step towards increasing preventative health care for cervical cancer among Hispanic women through education about preventative methods.
Population profile, cervical cancer among Latina women. Receiving the HPV vaccine can be very beneficial in order to protect against cervical cancer. Among Latina women in Los Angeles, the incident rate is much higher than among non-Latino women. Within the United States, cervical cancer mortality rates have remained significantly higher over the years. Reasons for this could be being uneducated, misinformed, or due to personal beliefs. Each year, there is an estimated total of almost 12,000 new cases of HPV associated with cervical cancer that is diagnosed in the United States. The diagram presented shows that Latino females have the second highest death rate for cervical cancer. These results could be from decreased access to Pap tests and a follow-up treatment. The World Health Organization states that more than 610,000 new cervical cancer diagnoses and 322,000 cervical cancer deaths. Importance of health issue. So why should you get tested? Advantages. Getting tested is an important factor for a female's health. Pap tests are usually every 2 to 3 years for women between the ages of 20 and 65. Taking this step can reduce the risk of dying from cervical cancer. Screenings allow for abnormal cells to be detected within 30 years. Doctors are able to remove the parts that contain these cells before cancer. So advantages would include leads to reducing the chances of getting cervical cancer, early detection improves the chances of recovery. Some of the disadvantages would be waiting for the results can cause anxiety and can be uncomfortable and painful at times. Here is a mini clip.
It's been said that knowledge is power. So know this. You can prevent cervical cancer by getting screened. How's that for powerful? Take control of your health.
Some prevention strategies include getting the HPV vaccine, eliminating smoking, limiting your sex partners, and using protection.
Epidemiology of cervical cancer. A total of 12.5 new cases of cervical cancer were diagnosed in 2014. That is a rate of 7.5 per 100,000 women, according to the Center for Disease. The total number of deaths within 2014 was 4,115 rate. So it's 2.3 per 100,000 women. The most frequent diagnoses in women is between the ages of 35 to 44, and cervical cancer screening is more prevalent in Hispanics than non-Hispanics that are white. Basically, there's increased rate of 77 Hispanics more that will get cervical cancer. The statistics on the health issue is, according to the American Cancer Society, there are approximately 10,000 cases and 3,700 deaths from cervical cancer in the U.S. per year. Latina women in the United States have the highest cervical cancer rates among all racial ethnic groups. Latinas face high mortality rates from cervical cancer as a result of their low rates of of screening. About 85% of women who die from cervical cancer never had a pap smear. And the overview of health behavior. In 2014, a total of 472 deaths from cervical cancer occurred just in California. A total of 1,391 new cases were diagnosed in California as well, same year. Hispanic and Latina women have the highest incidence of cervical cancer compared to other ethnicities, as said before. Despite having one of the highest incidence of cervical cancer, Hispanic Latina women undergo significantly fewer pap tests than non-Hispanic white and Black women. There is also a kind of study that I saw and that I read that Hispanic and Latina women who have been in the U.S. for less than 10 years are less likely to have had a pap test in the last 3 years than those who have been in the country for more than 10 years. Hispanic girls also have a relatively low uptake of the HPV vaccine compared to their counterparts and other vaccines. The barriers that Hispanic women face to receive a pap test include limited access to health care, low education levels, embarrassment and pain during the test, providers who cannot communicate in Spanish. And this just follows through with the barriers that lead to cervical cancer screening, such as religion. Some women don't have the economic ways or health benefits to get a pap test. It could be due to religion, it could be due to cultural barriers, and those usually affect the Hispanic community, and that's why they don't get screened.
Breaking news. Hispanic and Latino women have one of the highest incident rates of cervical cancer. Informing an individual of their risk factors and consulting with their doctor can allow for a person to be more informed in regards to the possible healthcare options. Some of the risk factors for cervical cancer include immune system deficiency, oral contraceptives, alcohol use, obesity, HIV infection, socioeconomic factors, and age. Results show that Latina women undergo significantly fewer pap tests than non-Hispanic white and Black. Did you know? Cervical cancer is often preventable. All women 21 and older should get regular exams. Warning signs of cervical cancer may be serious. Latina women face high mortality rates of cervical cancer as a result of low rates of being screened with barriers such as lack of immigration status, lack of knowledge, lack of insurance, and lack of English proficiency.
So these are the theories proposed to address the health problem. The first one is protection motivation theory, a theory of planned behavior, social cognitive theory, and community readiness model. So the first one is the protection motivation theory. So that one was developed by Rogers in 1975. It describes how individuals are motivated to react in a self-protective way toward the perceived threat. It explains motivation by fear, risk appraisal, coping appraisal, and it consists of 7 constructs. So those are the 7 constructs, which are split into 2, the risk appraisal and coping appraisal. So under risk appraisal, there's severity, which is a that the threat will have severe consequences. And then there's also vulnerability, which is the likelihood of developing cervical cancer. So, for example, genetics or family history. An individual with family history of cervical cancer is more prone to developing the disease as well. And next is intrinsic reward, which is physical and psychological satisfaction. And there's also extrinsic reward, which is associated with peer approval and support. And for coping appraisal, there's response efficacy, which is the belief that performing the behavior will prevent the health threat. And self-efficacy, which is the ability to perform the behavior. And response cost, which is the cost associated with behavior. So it could be, for example, taking time off the day or work to get the cervical cancer screening, or even money. If there's no, if someone doesn't have insurance, it would also take money. And then we have the theory application. So this is how theory applies to the health problem. It's useful in determining factors that play a role in women's intention to get screening, and it also helps women understand the consequences of not getting tested. So why use the protection motivation theory? It's used as guidance to investigate cervical cancer screening interventions among Hispanic women in Los Angeles, with focus on cancer knowledge, some demographic factors, and awareness of everyone's experience with disease. So this is an example of how protection motivation theory has previously been used. This study was to test the theory and predict screening intentions. The participants were women with no cervical cancer history from randomly selected villages from Wuhan, which is a rural country in China. And 6 constructs were measured using the standardized questionnaire. And the results were 57.7 believed that regular screening reduced cervical cancer risk, and 45.26% agreed that women should be screened regularly. And these are some of the pros and cons. The theory can be measured quantitatively, and a few of the strengths include that it can influence an individual's ideas and intentions. It also examines specific underlying cognitive processes that happen when an individual encounters it. And one weakness is that it does not consider useful behaviors for equitable for social and environmental. And this is just a model of the protective motivation theory. Protection motivation theory. So it starts with the intrinsic and extrinsic rewards, plus the severity and vulnerability, which leads to the threat appraisal. And we also have the response efficacy, with response cost that leads to coping appraisal, and both of those together leads to the behavior, which is getting screening, and that's what concludes the protection motivation.
So another interpersonal level theory is the theory of planned behavior. This theory was introduced in the 1980s and is an extension of the theory of reasoned action. The theory of planned behavior suggests that when there is intention to perform a behavior, an individual engages in the behavior. Intention towards a behavior is comprised of 3 constructs that collectively affect a person's actual control over a behavior. So these are the 3 main constructs of the theory of planned behavior. The first one being attitudes. This is the extent to which someone views participating in the behavior as positive or negative. The second one is subjective norms, which is perceived social pressure to engage in the behavior. And the third one being perceived behavioral control, which is the perceived ability to successfully perform the behavior. And on the right is a visual representation of this theory. So before engaging in a before engaging in a behavior, someone might ask themselves, do they like it, what others think of it, and do they have the right skills to do this? When all 3 of these constructs are met, then this leads to the intention to do it, and then Now the strength of this theory is that it has already been successfully used to predict and explain a wide variety of health behaviors such as smoking, drinking, and the utilization of healthcare. The limitations is the theory of planned behavior does not take into account environmental or economic factors that may influence intention to perform a behavior, which our targeted population being Latina women, we know that their barriers include economic and environmental. So application of this theory can be used to predict the intention of cervical cancer screenings among Latinas. Understanding the determinants which affect their intentions of getting medically tested can help create interventions which address these issues and thus reduce the high incidence rate cervical cancer among this population. Previously, this theory has been used to predict cervical cancer screening behavior among women in the United States with Mexican origin. Baseline interviews were conducted to examine how the three constructs affected Latino women's screening behavior. It was found that women with a higher perceived behavioral control expressed greater intentions of getting screened. So this suggests the need for interventions to increase Latina's sense of control over undergoing screening.
Another theory that can help address this health issue is the interpersonal level theory, which is social cognitive theory. The SCT is a theory that is based on how observational learning and modeling can help an individual adopt, initiate, and maintain a health behavior. It is affected by environmental factors, personal factors, and behavioral factors. Overview of social cognitive theory. It was developed by psychologist Albert Bandura in the 1960s. It described how an individual interaction with another person or environment can shape a behavior or someone's behavior. It also focuses on the processes of observational learning and modeling. It consists of five constructs. Social cognitive theory constructs are knowledge, self-efficacy, outcome expectations, goal formation, social structural factors. For knowledge, it's understanding how to participate in a health behavior. For example, understanding what is a pap smear, understanding what is cervical cancer, the pros and cons. Self-efficacy is an individual's belief in their ability to exercise a behavior, being able to overcome obstacles. So it's just a belief, the person's belief that they can overcome this behavior or exercise this behavior, for example, or making the first appointment to the doctor so they can get a screening. Outcome expectation is observing others do a behavior. It can influence another person to change his or her behavior. And expecting a reward when the health behavior is completed. So, for example, if a woman sees another woman make an appointment to go see a doctor to get screening, she might be encouraged to go and make an appointment herself. Therefore, the reward is her getting a pap smear screening. Therefore, it's negative and things are fine. Goal formation. Goals can be self-incentives. They can work as guides and motivation to a health behavior. For example, doing little small goals like making the appointment once again, meeting with a doctor, especially like maybe a Spanish speaking doctor that would be easy to communicate. Social structural factors are like barriers or supporting factors of an individual's motivation. So barriers such as like them not wanting to go because they don't want to feel pain, they're embarrassed, and other supporting factors as like, oh, they're having the support of their friends are going, they want to get involved with like also in the appointments, trying to get themselves screened. So moving forward to application of social cognitive theory, the social cognitive theory was used in a study to promote pap smear follow-up in adolescent girls. The study interviewed 15 girls individually. The research provided knowledge, reinforcement depending on each girl's concerns. It also changed their behavior since they no longer had to perceive themselves as high risk or cervical cancer after getting a pap smear. Many were able to overcome barriers such as having pain or embarrassment. It gave them comfort and a consistent relationship with a health provider since they knew that they felt comfortable that they spoke Spanish or they were able to communicate. Pros and cons of social cognitive theory. So some strengths of social cognitive theory is that it's a very broad theory. It can be combined with other theories in order to change a behavior, a health behavior specifically. And also, it helps develop an individual's tools so they're able to make themselves a self learner. Some limitations are changes that happen in the environment don't always change the individual's behavior. Social cognitive theory does not take into consideration biological or hormonal operators. It can work for some public programs, but not for others if it doesn't address a behavior change. It can be kind of tedious. So at the community level theory, there is the community readiness model. This model um, is a model for community change that integrates a community's culture, their resources, and their level of readiness to more effectively address the health issue. The CRM offers tools to measure readiness and to develop stage-specific strategies. It can be applied in any community, geographically, issue-based, and organizational. There are 9 stages to the community readiness model. The first stage is no awareness, which is when there's a health problem but the community views it as the norm. Then there's denial. There's little or no recognition of the health issue. There's vague awareness. That's when some community members feel that there is a health problem, but there's really no motivation to change it. Pre-planning is when they're talking about the issue, but they're not really taking any steps towards making a change. Then we have pre-preparation, and that is planning to make a change and are starting to look into resources. The next step is initiation, and that is when information is being made available to the members in the community and efforts for an intervention begin. Stabilization is when community leaders support the communities and their activities. Confirmation is the community is comfortable addressing that there is a health issue. And last is professionalism, is when the community involvement is high and effective evaluations are used to test and monitor. Some things that you can use the community readiness model for is that it saves time and money. It's effective, it's inexpensive, and it's an easy to use tool. The model breaks down the process into a series of manageable steps, such as 9 stages of readiness. It helps to ensure that strategies are culturally congruent and sustainable. It also creates a community vision for healthy change. What not to expect from the CRM is that the model can't make people do things they don't believe in. It does not advise exact details on what to do to meet your goals in order to make the community change. The community readiness model was applied to a study done on breast health disparities, and the model was applied in 4 different phases. So phase 1 conducted survey interviews with community leaders to address the community's readiness about breast cancer. Phase 2 conducted a focus group interviewing, exploring Latinas' perception and influences on their decision to get mammograms. Phase 3 conducted 14 one-on-one interviews with underrepresented Latinas for each community. And phase 4 analyzed data from previous phases to formulate culturally appropriate strategies to recruit and retain Latinas in breast cancer. The CRM was used to successfully reduce further threat and implement prevention and early detection mechanisms, breast cancer mechanisms. With the application, these communities were able to implement mobile mammogram vans, and it has provided the community members with early detection. And the strengths of the CRM are that it gathers information about a particular health issue problem from various levels in the community, starting with awareness of the health issue and then moving to the collective and individual opinions. The limitations for the CRM is that the study findings are only generalized to Latinas living in the 4 communities in Colorado.
So the slide presented right now is an ad we created. The ad shows the ad's purpose is to get more Latino women to come in and do pap smears in clinics and get the HPV vaccine. Um, we intend to do so with this ad because the ad does have a statistic that states about 85% of women who die from cervical cancer have never had a pap smear. Uh, we believe that this will get the thought in um, Latino women's head to probably make an appointment to get a pap smear. In the ad, we also give 3 ways to prevent and detect cervical cancer. The 3 ways are to get a regular pap smear test, get the HPV test and vaccine, and do regular pelvic exams. The ad does show a photo of a doctor with her patient. The photo creates a friendlier environment if there is a negative thought of going in for a pap smear, as well as the photo also showing a Hispanic woman, which also gives like our who we want our audience to be. For our theoretical framework, we go into attitude and knowledge being the first. We decided on attitude because we want to know what the patient or individual thoughts are on getting a pap smear or HPV vaccines, whether they view this as a positive or negative behavior. We want to know the knowledge they have of cervical cancer, how it's developed in the body. Afterwards, we would start the pre-planning, which would be talking to them about resources or how they can get a pap smear test or HPV vaccine. Therefore, bringing the idea into their head. Um, we move on to outcome expectations and severity. With outcome expectations, we plan to give them the benefits of going through with a pap smear test and HPV vaccines, such as not getting cervical cancer or not or protecting themselves from getting an STD infection or an STI. With severity, we plan on talking about the consequences of cervical cancer or like the um, negative outcomes when not getting a pap smear or HPV vaccine, therefore leading to the self-efficacy of Latino women getting pap smear. We hope that with all those steps, they'll see the benefits of getting a pap smear and that leading them to have the power to actually going in and getting a pap smear. So in conclusion, if intrapersonal level constructs and interpersonal level constructs, such as attitude and knowledge, influence the community level construct of willingness for pre-planning, then intrapersonal constructs and intrapersonal level constructs of severity and outcome expectancy will explain the benefits and effectiveness of getting a pap smear test and HPV vaccine.
Thank you for listening to our theory suggestions for increasing Latina's reproductive health. Here are some helpful tips to get HPV testing. For example, you can apply for the family pack card. It's just a card that allows you to get free birth control or free checkups for any woman. And also, all you have to do is just fill out a few forms and will qualify. And some examples are
You can go to Planned Parenthood or FPA Women's Health, and they will be able to guide you and help you out for all your women's health.
You can also go to a college or university student health centers, and you will be provided with help and assistance there on obtaining a pap smear exam or an HPV vaccine.
And last but not least, community clinics also accept the family pack card.
and here are our resources.
Thank you.
Thank you.